So all that said, let's get started. I'm happy to have Dr. Cortright with us today as a guest speaker. He's the author of 2 #1 international Amazon bestsellers, Functional Psychology for Anxiety, Depression, and Cognitive Decline, as well as the Neurogenesis Diet and Lifestyle, Upgrade Your Brain, Upgrade Your Life. He is a professor emeritus with the California Institute of Integral Studies and a licensed clinical psychologist with a private practice in psychotherapy and a coaching practice in San Francisco and online. Now I'll turn the talk over to Brant Cortright. Welcome, Dr. Cortright.
Thank you. Thank you for having me. So the title of this is Functional Psychology for Peak Brain Performance and Cognitive Decline. And I want to just say what functional psychology is. So I'm trying to integrate the principles of functional medicine into psychology. Functional medicine, as many of you probably know, tries to treat the underlying root cause of illnesses and disease rather than treating the symptoms. And they do this in large part through diet and through changing lifestyle factors. And I'm going to, in this presentation, try to integrate all of that into psychology. Next slide, please. So we are psychophysical beings, right? This kind of is obvious, but I was trained as a clinical psychologist, and as a psychologist, we focused really on the psyche, not so much the brain or the body. Psychiatry, on the other hand, coming out of medical science, sees human beings and sees, it's really become biopsychiatry at this point, really sees the brain as the centerpiece. So when it comes to something like, say, depression or anxiety or cognitive decline even, the psychologist side sees, okay, well, with depression, there are physical changes in the brain, but these come about from unskillful behaviors. That is, the way we lead our lives lead us to feeling depressed, and that brings about the brain changes. Whereas biopsychiatry sees depression as a physical biological illness that requires treatment in the form of medication. So brain changes happen, depressive symptoms occur in the psyche, but what causes what? It's a chicken or egg sort of thing. And for most of my career, I was on the psychology side, thinking, okay, well, 80% of it is probably behavior and maybe 20% is brain dysfunction. But I've come to see it's not a chicken or egg thing, it's a chicken and egg thing. We are psychophysical beings. And I think psychology needs to integrate more of brain science, just as psychiatry needs to integrate more of psychology, basically. Next slide, please. So the quality of our brain, the quality of our psyche determines the quality of our life. High quality psyche and brain, high quality life. Next slide, please. This is going to get a little bit low quality life. Next slide, please. And mediocre quality, this is where most people fall. Most people have a mediocre quality brain and psyche and lead mediocre lives, much of which is covered over by consumerism, by distraction, by being lost in the internet and phones, but nevertheless is there. Next slide, please. Not to put too fine a line on this, but not only are we psychophysical beings, we actually exist on different levels. And there are 4 major levels that I think probably most holistic approaches look at, which is body, heart, mind, and spirit, right? That we are multidimensional beings. And what that means is that we exist on these different levels. There's a physical, sensory, motor, brain level we exist on. There's an emotional, heart level Our emotional experience gives us information about the world that we don't get any other way. There's a mental, cognitive aspect, and then there's a spiritual dimension to us as well. Next slide, please. So one thing that has been pretty clear to me and to the field of certainly existential humanistic psychology for some time is that pretty much everybody grows up in conditions that they may be pretty good, but they're less than ideal and live well below our actual potentials. Next slide, please. And a holistic approach to this means we are really working on all four levels in order to discover our potential and to realize it. Next slide, please. So we're going to be looking at a number of steps we can take in in all four of these areas. Next slide, please. I want to just say briefly something about the epidemic of Alzheimer's. Alzheimer's has increased 5 times since the 1960s. Most people are now expected to live to be 85, and we're almost there now, but pretty soon we'll be to the point where half of 85-year-olds will be diagnosed with Alzheimer's. 1 in 3 seniors die with dementia. It's double the rate for women and for African Americans. Next slide, please. And as probably you all know, there have been billions of dollars spent on clinical trials for drugs. There have been hundreds of clinical trials, and they have all failed. There's a lot of publicity about a recent clinical trial that showed a slowing of cognitive decline in Alzheimer's patients. And I think it was like a 20% slowing. Most of the critics of this research are saying this is very, very little, but it's the only thing that has done anything in terms of pharmaceuticals. The Buck Institute here in California has done some research in this area and has come up with some pretty interesting research looking at really a holistic lifestyle rather than pharmaceuticals. Next slide, please. So some of the recent research, both into psychology as well as in neuroscience, is showing us that not only does the psyche and the self exist at a lower level than it needs to, but the brain does as well. Next slide, please. And it's showing us that in living below our potential, we can actually enhance functions on all 4 of the levels we exist on. Next slide, please. So radiant brain health, which is when the brain is functioning on all cylinders, looks like this in a nutshell here. Next slide, please. First of all is cognitive enhancement, right? That the brain becomes clear, becomes sharp, learns things quickly, figures out things quickly, rapid problem solving, increase in creativity, memory enhancement. You learn things faster, you retain it longer. Next slide, please. There's increased physical vitality, even increased immunity to some degree. Next slide, please. And robust emotional resilience. That is, it feels good simply to be alive, that there's a sense of vitality, a sense of excitement, a sense of aliveness energetically. And there is protection against chronic stress, against anxiety, against depression, and cognitive decline. Because all 3 of these are related. Anxiety, depression, and cognitive decline share some similar neural pathways, which we will be getting into. Next slide, please. And there's also a sense of greater presence. When the brain is functioning at a high level, when the self is functioning at a high level, there's a sense of being more there, more present. Next slide, please. One of the comparisons that the brain is often made with is that of a computer. And I'd like to just take a minute to say this is a terrible analogy, actually, because the brain is not a dead, static circuit board. It's a living, growing, moving process. So the brain is more like an amoeba. It's always in motion. It's always moving. It's always making new connections. Your brain is changing all the time. As you're watching this, your brain is changing in order to even take this in. It's always remodeling itself. It's always getting rid of connections that aren't being used, building connections that are being used. Every new experience means there's a change in the brain. So we need to think of it as like a slow-moving organism rather than a static computer. Next slide, please. Next slide, please. Next slide, please. So only in the past maybe 20 years, and certainly even more in the past 10 years, have we discovered what actually is involved in the brain degrading, in the brain becoming less and less efficient, working less and less well, and what actually can enhance the brain, what actually strengthens, nourishes, and allows the brain to function on all cylinders. Next slide, please. So one of the things that has been discovered is that there are a lot of things that degrade brain function. Next slide, please. So there are toxins on all levels, physically, emotionally, mentally, spiritually, but there are a lot of physical neurotoxins. And some of these people know about, but there's a lot that they don't know about. Heavy metal toxicity, for example. Most people know about mercury. Mercury is, I believe it's the second most powerful neurotoxin outside of plutonium. Just a tiny bit of it just zaps brain cells. Lead is another one most people know about. If you look up neurotoxins in Wikipedia, you get something like 30 pages of lists with 20 on each page. There are an amazing number of neurotoxins circulating in the environment right now. One of these, so many people don't even know about. So phthalates, which appear in plasticizers, appear on receipts when you get them. Plastics are endocrine disruptors, which also, in disrupting the endocrine system, disrupt brain function. Smog. Smog, something like 90% of the planet's population lives in smoggy areas. And the little tiny particles in smog, the 2.5 micron particles and below, are so small that they are able to enter the lungs, enter the bloodstream, and actually cross the blood-brain barrier, where they act like little wrecking balls in the very delicate neural tissue there, creating inflammation, creating oxidation. There are some researchers who believe that 30% of Alzheimer's can be attributed simply to smog. Poor nutrition, we will get into in a minute. This is very big, very important. The standard American diet, which is abbreviated SAD, is basically a disaster when it comes to the brain. High carbohydrate, low good fat, high bad fat, processed foods, high sugar, lots of pesticides. It's a disaster for the brain, and we'll get into that in a bit. Chronic inflammation, as we know, is behind most major diseases, of the chronic diseases, cancer, heart disease, it's in diabetes, Alzheimer's for sure. And most people live a highly inflammatory lifestyle, not only in terms of the food they eat, but the lifestyle that they lead. And we'll get into that as well. Antibiotic overuse and decimating the gut microbiome. So the bacteria in our guts, in our intestines, have a major role in our brain function and in our psychological function and our emotional function as well, our cognitive function. We'll get into this in a second, but because of the overuse of antibiotics, both from childhood on, but also the environment, right? Like beef are fed. Most of the antibiotics in the country go to meat and to prevent diseases in livestock. So when you actually are eating beef, you're also getting some of this antibiotic, which is also wiping out your microbiome. High blood glucose. Something like 80% of the country has some degree of insulin resistance because of the high carbohydrate diet across the nation. High insulin resistance and high blood glucose brings about cognitive decline quite rapidly, and we'll get further into that soon too. Poor sleep, pesticides, and leaky gut. Let me just take 1 second to talk about this. So glyphosate is the most widely used herbicide in the world. 300 million pounds of it in the United States every year. It's used a great deal in China, in India, and Brazil. So glyphosate is, first of all, it's an antibiotic. So it wipes out the microbiome, and it is something that opens up the tight junctions of the intestines. So the tight junctions are the little teeny cellular structures that let in the good stuff and keep out the bad stuff. When the tight junctions open up with glyphosate, it lets in all sorts of, first of all, it lets in bigger food products, which creates inflammation. And it also lets in toxins. Excuse me. And these toxins create inflammation in the gut, so it creates a kind of leaky gut. UCSF did a survey, I think it was about 10 years ago, maybe not quite that long. And it found that 93% of Americans all across America had measurable levels of glyphosate in their bodies, probably up to 95% by now. Glyphosate not only lets in particles into the body from the gut, but glyphosate also then acts with the blood-brain barrier. And the blood-brain barrier responds to the same molecular signals as the gut. And so the blood-brain barrier also opens up and also lets in toxins, lets in things that shouldn't be going into the brain, which creates inflammation, oxidation, and cognitive decline, depression, anxiety. It slows down the neurogenic process. So there are certain parts of the Midwest where glyphosate is in the dust. It's in the rainwater, also in the South, and some parts of the valley in California as well. Unless you eat a purely organic diet, you probably have some degree of glyphosate in your system, which is degrading not only your brain, but also your physical health as well. There's other things we can go into, but I just want to make the point that there are more toxins, more neurotoxins in the environment than at any time in history, by far, and it's increasing. Next slide, please. There are also emotional neurotoxins. Chronic stress is a huge neurotoxin. We'll get into that more. Trauma. angry relationships, relationships where there's fear, bullying relationships, having too much stimulation as well as having too little stimulation. Loneliness is also a stressor that affects the brain. Living online. This is a different kind of world we're living in now. The human brain did not evolve to relate to screens. It evolved to relate to other human beings in the flesh. Next slide, please. And there are also mental, spiritual, and spiritual neurotoxins. Being always online, spending the overstimulation which comes from being always online or spending much of the day online. Bad news. The loss of meaning, the lack of spiritual community. We'll get into this somewhat later also, but again, just to make the point that neurotoxins exist on different levels. Next slide, please. So Dickens was right when he said it was the best of times, it was the worst of times. Never in the history of the world has there been so many neurotoxins in the environment. At the same time, paradoxically, we've never known more about how to enhance brain function, how to make actually our brain work in ways which it never has been able to before. Next slide, please. So it's a two-pronged strategy. We want to do the things that help the brain, and we want to minimize the things that harm the brain. One of the things that I think is an unfortunate result of kind of the pharmaceutical age we're living in is the belief that a pill is going to solve everything. It's pretty clear to me, and I think to many people in the field, that there is no magic bullet here, no silver bullet. That what we need to do is cross-train the brain and the psyche. We need to work at every level, physically, in terms of the brain, and mentally, emotionally, spiritually, psychologically, so psychospiritually as well. Next slide, please. Next slide, please. So when we talk about the physical side, probably the most important intervention would be through diet. Next slide, please. And I think about 4 different pillars to a healthy brain diet: neurogenic, ketogenic, anti-inflammatory, and gut-friendly. So we'll go into each of these: neurogenic, ketogenic or low carb, anti-inflammatory, and gut-friendly. These 4 pillars are really helpful when it comes to enhancing brain function. Next slide, please. So when we talk about neurogenic, we're talking about neurogenesis and synaptogenesis. Next slide, please. Neurogenesis means we grow new brain cells. It's the genesis of new neurons. Up until the late 1990s, it was believed that the brain stopped growing in our early 20s, and it was just a slow downhill slide after that. But then they discovered that actually the brain makes new brain cells throughout our entire lifetime, up until the very time we die. Now, at first, they didn't quite know what to make of this. They thought, okay, well, there's more new brain cells, great. But then they discovered actually the rate at which we make new brain cells has a powerful effect on the quality of the brain and the quality of our life. Next slide, please. They've known about neuroplasticity for a long time, also known as synaptogenesis, which is making new connections among existing neurons. Next slide, please. Both of those are known as your neurogenic rate. Fred Gage, a scientist at the Salk Institute in San Diego, and the discoverer of neurogenesis in the late 1990s, increased the rate of neurogenesis in mice and was able to increase it by 5 times. And when he did this, he discovered that they became not quite super mice, but almost. They had enhanced cognitive function. They learned things faster. They were sharper than their low neurogenesis rate peers. They had this very robust emotional immunity. They are emotional resilience. They were protected against stress, anxiety, depression, which they are very good at creating in mice. And what brought this about was really a holistic approach, creating what he called an enriched environment. Next slide, please. So the most important biomarker of brain health that most people have never heard of is your neurogenic rate. Low neurogenic rates are associated with stress, anxiety, depression, and cognitive decline. Next slide, please. A high neurogenic rate are associated with the opposite. Again, cognitive enhancement, rapid learning, robust emotional resilience. Next slide, please. So over 30 nutrients have been discovered that increase the rate of neurogenesis, and dozens of others increase brain-derived neurotrophic factor, which is one of the main drivers of neurogenesis and synaptogenesis. Next slide, please. Probably the single most important dietary change anybody can make is to make sure you're getting enough omega-3s. So the brain is composed of almost 2/3 fat, and 1/3 to 1/2 of that is DHA. So omega-3s consist of ALA, EPA, and DHA. ALA isn't hugely important. EPA is very important, high anti-inflammatory for the brain and the body. And DHA is what makes up much of the brain. It's the fundamental building block of the brain. So to build a high quality brain, you need to provide high quality building materials, right? If you're going to build a high-end house, you don't want to use rotting lumber. You want to use high-end materials. It's the same with the brain. Most people should aim for 3 to 4 grams a day of omega-3s. And depending on your inflammatory levels, you want to have 50-50 EPA and DHA. If you have high levels of inflammation, you probably want 2-to-1 EPA to DHA because you want to bring those inflammatory levels down. Next slide, please. Actually, let me just say one more thing about omega-3s because they are so important. You want to make sure that they are molecularly distilled because that takes out the mercury, that takes out the heavy metals. Most omega-3 comes from fish oil, and fish tend to accumulate mercury. And so certain kinds of, much of the omega-3 market actually is not molecularly distilled and has significant levels of mercury and other toxins in it. So if you get molecularly distilled omega-3, that is going to be better for you. So other things that do this, and you can go through the next couple slides, I think, now too. Green tea. Green tea is a powerful neurogenic stimulator, and it not only increases the rate of neurogenesis and synaptogenesis, it also increases the rate at which we get rid of oxidation. So it's a powerful antioxidant, a powerful anti-inflammatory. Hesperidin, a bioflavonoid from citrus, is not very bioavailable, but methylchalcone is. And what this does is it keeps new brain cells alive. Luteolin, apigenin, quercetin, these are some other bioflavonoids that have a big impact on our neurogenic rate. Next slide, please. Blueberries are one of the best things you can do for your brain. Highly neurogenic, highly anti-inflammatory, highly antioxidant. L-carnosine, it is not only highly neurogenic, but it also is anti-inflammatory, anti-cancer, and anti-glycation. Both books actually go into a pretty extensive list of these nutrients that are neurogenic. Next slide, please. We also want to avoid things that slow neurogenesis down and synaptogenesis down. So high sugar diet will cut your neurogenic rate in two. So if you think about the standard breakfast of the American child, high sugar cereal, bad already. It's going to create inflammation and it's going to slow down the neurogenic rate at a time when it should be just exploding. Next slide, please. Alcohol, again, a neurotoxin, slows down the neurogenic rate. Next slide, please. Deep fried foods are highly inflammatory. And when that inflammation then gets into your bloodstream, it chews up the inside of your blood vessels. And so we want to avoid inflammatory foods, and I don't want to go into that here now, but the biggest culprit probably would be deep fried foods. French fries, onion rings, fish and chips I used to love. Sorry, I just can't do it anymore, or I do it extremely rarely. Yeah, we want to avoid that at all costs. Next slide, please. Ketogenic or low carb. So we have neurogenic, now ketogenic. So the brain and almost all cells of the body can be fueled either by glucose or by ketone bodies, by fat. Glucose is a dirty fuel. That is, it creates inflammation, it creates oxidation, creates a lot of toxic byproducts. Ketones, on the other hand, fat as fuel, is a very, very clean and efficient fuel. A researcher at Harvard who recently died researched the effect of ketone bodies on the heart cells and the mitochondria of the heart, and found that the heart operated at, he said, 28% greater efficiency. It's Dr. Veach. Now, the mitochondria of the heart and the mitochondria of the brain are similar. And so if you can imagine your brain operating at 28% greater efficiency, we're talking about a significant, when your brain is operating along with ketones, fueled by ketones, there's a way that there's a clarity, there's a stability, there's a way that you feel like you are operating on all cylinders. And then when you go back to eating carbohydrates, there's a kind of dullness. You begin to see, oh my God, I've been operating at a much lower level than I thought. Dale Bredesen, who probably you all are familiar with, one of his major interventions with Alzheimer's and preventing Alzheimer's is a ketogenic diet, right? That Alzheimer's, certain types of Alzheimer's is being called type 3 diabetes. It's a dysfunction of glucose metabolism. And so if we can shift to using ketones for fuel, rather than simply glucose just being a sugar burner, we are going to enhance brain function. And because ketone bodies are also neurogenic, we will increase the neurogenic rate. Next slide, please. So we want to eat good fats, right? And a ketogenic diet or a low carb diet means getting most of our calories from healthy fats. Although the bulk of our food will probably come from vegetables, right? Fiber. We want moderate protein, high fat, and low carbohydrate. We want to avoid cooking with vegetable oils because these are highly inflammatory. So better to cook with butter, ghee, coconut oil, lard. Next slide, please. Next slide, please. Just briefly, one test that everybody should do is called the hemoglobin A1C, which is a snapshot of your blood sugar over the last 3 months. If that is over 5.0, 5.1, 5.2, which almost everybody's is over the age of 30 or so, you do well to bring it down, because the higher your hemoglobin A1C is, the more rapid your rate of cognitive decline. It's a very clear thing. It doesn't just happen at the diabetic level or even the pre-diabetic level. It happens at these lower levels that most physicians say, oh, you're fine. Well, if you're 5.6, you're not fine. You're going to be degrading your brain at a much higher rate. And so the way to bring your hemoglobin A1C down is to reduce your carbohydrate intake. If you are lactose intolerant, you stop eating lactose. If you're gluten intolerant, you stop eating gluten. Elevated blood sugar, insulin resistance, is also being called carbohydrate intolerance. And so we want to reduce carbohydrate. Okay, third thing, anti-inflammatory. We want to eat anti-inflammatory foods, and we want to stay away from pro-inflammatory foods. Next slide, please. Next slide, please. And gut friendly. We want to increase the microbiome, which has been decimated. Indigenous cultures have about 20,000 different strains of bacteria, right? It used to be thought there was 100 trillion bacteria in your gut. They've done a recount and they realized there's actually about the same number of cells in your body as there are bacteria in your gut, which is about 40 trillion. Now, in indigenous cultures, they have 20,000 strains of bacteria. In the West, most people have about 10,000 strains. Some people, particularly those who are ill, have a few thousand, sometimes as low as 500 or 1,000 or two. This is hugely problematic for the immune system as well as for the brain. 80% of your neurotransmitters are produced by your microbiome. There have been studies to show that certain strains of bacteria will enhance cognitive function. And given all the antibiotic overuse in the West, and given the antibiotics in the food supply, and given the glyphosate that is everywhere, you'd be well advised to eat a purely organic food diet, if at all possible. Next slide, please. Okay, other physical factors. Exercise, especially aerobic exercise, is good for the brain. When neuroscientists want to increase the neurogenic rate of mice, they just put a running wheel in the cage, and that increases it faster than anything. Weight-bearing exercise, resistance training, is also very good. Building up muscle is also helpful for building up the brain as well. Sleep, I'm just going to run through these next things because we're coming to the end here. A lack of sleep slows down your neurogenic rate, decreases your immunity, increases your levels of inflammation. There's measurable cognitive decline with one night of not getting enough sleep. Being in nature is actually very stimulating for neurogenesis and synaptogenesis. Next slide, please. Next slide, please. And next slide, please. So we've looked at some of the physical factors in enhancing brain function. We also need to look at the psychological factors. Next slide, please. So some of these are emotional factors. So first of all, we need to feel safe. People who live in war zones, people who experience trauma, people who are in an unsafe interpersonal environment, whether it's bullying, whether it's a boss who is out to get you, whether it's coworkers who don't like you. Poor emotional relationships, toxic emotional relationships are also toxic to the brain. They slow down the neurogenic rate and they create anxiety and depression. People need a certain amount of social support. I mean, this seems obvious, but we live in a more isolated environment than we ever have. Something like 1/3 of people 50 and older live alone and complain of loneliness. This is a disaster for the brain. Loneliness is a bigger risk factor for depression and cognitive decline than smoking, which is almost hard to believe. We are social creatures. We are interpersonal creatures. And when we don't get that, it's a disaster. Or when we get the wrong kind. We need social support, but it needs to be real social support, not just contact, not just meaningless contact. When we're around people who really love us, when we feel love, when we feel loved and loving, that increases our neurogenic rate and that makes us feel good. Next slide, please. We need to be optimally engaged. Next slide, please. So chronic stress, we all know it's terrible. But there's also good stress. Good stress is like you're working a muscle, you're lifting a weight, you're breaking down the muscle, and then it builds back even stronger. If you do it too much, you'll destroy the muscle. A certain amount of optimal stress is helpful. So optimal stress is low to moderate and it's short term. But the kind of stress most people complain about is chronic stress, where there's no let up from it. That has a big negative impact on the brain. Again, it creates inflammation. It slows the neurogenic rate. And it has a lot of other side effects on other systems of the body. Next slide, please. And just because we're coming to the end, I'll just go through these quickly. So when you feel stress, you get a rush of adrenaline that's backed up by glucocorticoids over hours, days, weeks. Glucocorticoids are neurotoxic. Next slide, please. Next slide, please. Next slide, please. There's all sorts of disastrous things. So we want optimal stress, which means optimal engagement, where it's not too little stimulation, it's not too easy, it's also not too hard, it's not too frustrating, it's not too overwhelming. We want this Goldilocks zone where our capacities meet the environment in a way that brings forth our deeper capacities, our deeper potentials, our deeper abilities. Next slide, please. When that happens, that stimulates the self to bring forth, to develop, to grow. It also stimulates the neurogenic rate. So one thing we always want to do is to be lifelong learners. Learning doesn't just mean taking classes or being in college. Learning means we are acquiring new skills, we are learning new information, but we can do this in a million different ways now. We can take a cooking class. There are good online resources now for learning new things. We want to be able to cross-train the brain. We want to be able to use it in different ways. We want to write, we want to read, we want to listen to music, we want to talk to people, we want to engage in idea conversations with other people. And we also want to be learning new things continually. Next slide, please. And there are also spiritual factors in this. There are two types of meditation practice which have been shown to dramatically increase our neurogenic rate. These are heart-centered practices, devotional, bhakti, heart-opening practices, and also mindfulness practices. And there's a few different types of these: concentration practices and open awareness practices, both of which have been shown to have a pretty dramatic effect on the neurogenic rate. So this slide says it all. Working with your brain and psyche is about the most important thing you can do. Next slide, please. We are, almost all of us, living well below our neurogenic potential. Next slide, please. When your neurogenic rate is high, it's like paddling downstream with the wind at your back. Life you can meet the challenges of life. You feel good. It feels good simply to be alive. You've got the energy to meet the demands that you're facing. When you're knocked over, as we all are, you're able to get back up quickly. There's resilience. Next slide, please. So the quality of your brain and psyche is linked to the things we've just talked about: diet, exercise. Next slide, please. Psychological health. Next slide, please. Spiritual health. Next slide, please. I think we're done. So thank you all for listening to this. And is there any discussion or questions that we
There
have?
are some questions. Thank you very much, Dr. Cortright. That was a lot of wonderful, wonderful, stimulating information. We have a couple of questions here, and one of them is, you did not mention pets of any kind, dogs or cats, to be specific in the question. And is that helpful to the brain?
Yeah. There's a lot I didn't mention here. So that certainly is one of them. Pets are wonderful, particularly if they're pets that you can pet. So a dog or a cat is probably better than a goldfish. A goldfish is a little something, but it's nice to have an animal which is a mammal and also has a limbic system, right? Who also has an emotional brain. So if you look into the eyes of a horse or a dog, you can see there's a warmth there, right? There's an emotional being there. If you look into the eyes of a snake or a lizard, they're cold. They don't have a limbic system. So having pets, having a support animal, having another creature in your life or other creatures, very good. The touch is good. Touch increases your neurogenic rate, and that kind of connection does. Yeah, that's wonderful to have that.
Okay, good. Here's a question. Is there a point in life, a specific age or age range, that it's not possible to enjoy enhanced brain health with diet and lifestyle? And I might as well forget it and have lots of French fries and chocolate ice cream.
Yeah, there's no point at which this. So Fred Gage, with mice, he was able to increase the neurogenic rate in middle-aged mice 5 times. And in old mice, he was able to increase the neurogenic rate 3 to 5 times. So it's never too late. Increasing your neurogenic rate is going to enhance the quality of your life. No question. At any date. Yeah.
And so never give up.
That's right.
Okay. And is it possible to have a brain enhanced outcome without embracing each of the prescribed methods and still have a positive effect? The reason I ask is I could change my diet, but I can't move around much anymore. I'm limited in my walking ability.
Yeah. No, these are all synergistic. They all work better together, but you don't have to do everything. In fact, nobody can do everything. As many of them as you can do, the better. So yeah, when it comes to exercise, for example, some people can't do it. That's okay. Focus on diet. Focus on getting enough sleep. Focus on other physical factors and other psychological factors as well. It's not possible to take all of the neurogenic nutrients that will enhance the neurogenic rate. So you just take what you can, you do what you can, and whatever you do is going to be good. It's going to be helpful. Yeah, you don't have to do it.
And you mentioned all of our digital devices and that they, in fact, are toxic. Do you have any suggestions for weaning myself from my phone is the question. I find it impossible to put down even late in the evening.
Yeah, that is a tough one. The neuroscientists and the behavioral psychologists have really gotten big tech very sophisticated at addicting all of us to our devices. Getting that dopamine hit, no matter what we do, so that it becomes hard to turn it off. It becomes hard to let ourselves be bored. So it's not that we need to stop it, right? These are wonderful things. We want to be able to access the world's knowledge base at the touch of a finger. It's wonderful. But too much time, it looks like more than 3 hours of passive enjoyment of media, like for example, more than 3 hours of TV watching, slows the neurogenic rate and results in cognitive decline, even among 18-year-olds, even among young people. More than 3 hours a day of just passive TV watching, not good. We want something that you can be engaged with. So that is better if you're on the internet and you're doing email, you're doing something that is also using your brain, you're learning something. But still, you do want to spend some time just having downtime, having time just talking with other people, hanging out with other people. I think probably relationships are one of the biggest things that can fill in the gap. But also reading, reading has gone way down, but that is really good for your brain to be able to read, and to read hopefully not just on your phone or on your iPad, but an actual book as well. I don't think there's a good solution for this. People go on media fasts or on device fasts where they just don't do it for a day. It's kind of amazing what can happen if you spend time with friends during a day and you don't take your phone along.
That's so true. Mm-hmm.
So I wish I had an easy answer for that. That's a hard one. It's just something that you need to kind of keep in mind and realize, wait a second, this is not good for me. Even if I'm temporarily bored, boredom is good. Boredom is allowing the next emerging interest to emerge.
Okay. Here's a question. In terms of diet, there are many known, recognized good diets, such as the Mediterranean, the Mind, the DASH. Do you have any particular preference for any of those or thoughts on any of them?
No, they're all good, except that many of them are still high carbohydrate. And so they're not going to do much in terms of your blood sugar. And that's the important thing you want to bring down. If it's high, if your blood sugar is in the lower ranges, in the 4.0s, don't worry, go ahead, have sugar. I mean, sooner or later, you're going to get insulin resistance. And then you'll have to limit your carbohydrates. But if you have an elevated hemoglobin A1C, and again, everybody should get this test done. It costs $30 if you just order it online. You can also get it at your next physical. If you're over 5.0 or 5.2, you really want to bring it down because, as I said, you're not only going to bring your neurogenic rate down, but you're going to have a much more rapid rate of cognitive decline. Each 10th of a point it goes up is a faster rate of cognitive decline. So the only way that I know of to bring that about is to reduce carbohydrates and reduce this insulin surge, which happens when carbohydrates hit your system.
Now, one of our attendees is asking, what is the daily recommended amount of carbs you indicate? When you say low, is there a specific amount you can help us with?
That is very individual. It really depends on the person. You need to really experiment and see. In a ketogenic diet, generally people are lower than 20 or 30 grams a day. There are some people who are very active and they can do 50 grams of carbohydrate a day, but most people need to be at the range of 20 or 30 grams of carbohydrate a day. And it's amazing how carbohydrates can sneak into your diet without even realizing it. It's pretty much impossible to have zero carbohydrates, but 20 or 30 will get you into ketosis. And after 4 to 6 weeks, you will be what's called keto adapted. And at that point, you will be feeling really good and it'll be self-reinforcing. You'll want to continue to feel that way. But each person is different. You have to really see. And it may be that you can bring your blood sugar down simply by reducing your carbs, simply to 50, 60, 70 a day, as opposed to what they are now, which is probably 100 or 200 or more. So it just is very individual on this one.
Okay, thank you very much. Well, our time has come to a close, and a couple of you have written and said, will you get a copy? Maybe if you signed on late, you didn't hear that. I will send you a PDF of today's presentation, and I will include Dr. Cortright's website, which has a place where you can contact him. We want to thank Dr. Cortright for a wonderful presentation, very comprehensive today. We've gotten a lot of terrific questions. Thank you too to all the attendees for the very thoughtful questions today. We've learned so much about how to serve our own mental and physical health. This is really a wonderful care connection. Thank you. Please contact us at education@alzfdn.org. Or 866-232-8484 if you have any questions for the Alzheimer's Foundation. And I encourage you to sign up for the next Care Connection, which will be Thursday, January 12th at 1 p.m. Diane Trunacek will speak on what they wish they had known earlier, getting your ducks in a row for memory care options. She's a senior living advisor. She helps seniors and their loved ones narrow down their senior living options on an individualized basis on care needs and budget and other nuances that we may not be aware of. So it's all based on things that clients have asked her over the years that they wish they had known. So it promises to be very, very supportive and a lot of good information. Take care till then. And wishing you all wonderful and safe and very happy holidays. And thank you for attending today. And thank you again, Dr. Cortright.
Thanks for having me.